In today's episode, we'll talk about one vitamin that powerfully protects your body against cancer. And what's even more remarkable, it can also improve survival once cancer has already developed. Recent research shows this vitamin can cut the risk of certain cancers by up to 50% and increase survival rates among diagnosed patients by around 12%. That means it helps in two crucial ways. It reduces your chances of developing cancer, and it improves recovery outcomes if the disease occurs. Few natural substances show this kind of dual protection. But before we go any further, let's be absolutely clear. This information should never replace medical treatment. Any decision about your therapy must be discussed with your doctor. So what is this life-protecting vitamin? It's none other than vitamin D. Today, we'll explore how it works, how much you really need, and what you should avoid when supplementing. Let's begin. The discovery. Back in 1980, researchers from Johns Hopkins University noticed something fascinating. People living in areas with more sunlight had much lower cancer rates, especially colon cancer. For instance, the risk of colon cancer was up to 50% lower in sunny states like Arizona or New Mexico, compared to northern regions like New York or Vermont. The connection seemed obvious. Sunlight boosts vitamin D production in our skin, and vitamin D may protect against cancer. Since then, hundreds of studies have confirmed this link. And in 2006, a major scientific paper showed that even 1,000 to 1,500 IU of vitamin D daily could significantly lower the risk of cancer and cancer-related death. The evidence. But how strong is the evidence, really? Skeptics often claim there isn't enough solid data. However, a 2009 meta-analysis concluded that the theory connecting sunlight, vitamin D, and reduced cancer risk now meets nearly all criteria for biological causation. In other words, from a scientific standpoint, vitamin D does reduce the risk of developing cancer and improve survival once the disease is detected. Unfortunately, health policies often take decades to catch up with scientific evidence. And sometimes, the simplest solutions are also the least profitable ones. After all, preventing cancer might cost only a few cents a day. A small price for something so powerful. Survival and dosage. Research has also found that higher blood levels of vitamin D are linked with better survival rates in patients already diagnosed with cancer, particularly colon, breast, and ovarian cancers. For example, a 2015 clinical study found that patients with healthy vitamin D levels were much more likely to survive colon cancer than those deficient in it. Another study showed similar effects for ovarian cancer. And in breast cancer, patients with higher vitamin D levels had significantly lower mortality. Still, vitamin D's strongest role seems to be in prevention, not treatment. Once cancer develops, its effect is supportive, not curative. So the takeaway is simple. Don't wait. Prevent. Don't repair. Safe levels in supplementation. So, how much vitamin D do we really need? According to research, doses between 1,000 and 1,500 IU per day are effective for prevention. For people with deficiencies, it can take higher doses under medical supervision to reach healthy blood levels. Clinical studies show that even 10,000 IU daily is considered safe and doesn't cause toxicity, especially when paired with magnesium, which helps vitamin D function properly. And remember, vitamin D is fat-soluble, so it's best absorbed with meals containing healthy fats like avocado, nuts, or olive oil. Conclusion: vitamin D is unique. It's both a nutrient and a hormone, and it connects sunlight, food, and our body's own healing systems. It's not a miracle pill, but it may be one of the simplest, cheapest, and most powerful ways to protect your health for life. Get your sunlight, check your levels, and give your body the signal it needs to thrive.